Hi everyone, my name is Lianna. Today I'm going to do my presentation. The topic that I choose is oral anticoagulant warfarin. There are many drugs that affect the blood coagulation process in human bodies. The mechanism of action of anticoagulant varies depending on the agent. Today I choose warfarin. The pharmacological class of this drug is coumarins. The therapeutic drug class is anticoagulant and it is in pregnancy category X. It is contraindicated in patients with active bleeding, high risk for major bleeding, hypersensitive to warfarin, malignant hypertension, and pregnancy. Warfarin works. Warfarin is an oral anticoagulant that antagonizes vitamin K, thereby preventing the synthesis of four coagulation factors, factor 7, 9, 10, and prothrombin. Pharmacokinetics of warfarin. Warfarin is readily absorbed through the GI tract. It crosses placenta but does not enter breast milk. However, according to Koch, warfarin is still not recommended for lactating women. The oral bioavailability of warfarin is high, since the protein binding is 99%. It is highly bound to plasma protein, mainly albumin. The high degree of protein binding is one of the several reasons why this drug easily interacts with other drugs or food. It is metabolized in the liver and excreted in the urine and feces. Warfarin takes about 3 days to work and its effects last for 4 to 5 days. Since it takes time to work, this is not the drug of choice in an acute situation, but it is useful for the prolonged effects. For adult, PO dosage is 2 to 5 mg per day initially and then adjusted daily according to the PT and INR lab result. Two important lab tests in warfarin monitoring is prothrombin time PT and internationalized normalized ratio and INR. PT is the most commonly used test to measure the effect of warfarin. It measures the time it takes for the clotting mechanism to progress. Normal PT is 1.5 to 2 times control. NR is a way of expressing the PT in a standardized way in different places internationally. This ensures that results obtained by different laboratories can be compared reliably. Normal range INR is 2 to 3. The longer it takes the blood to clot, the higher the PT and INR. All range may be chosen based on different patient circumstances. Some adverse effects of warfarin are hemorrhage, ranging from bleeding gum with toothbrushing to severe internal bleeding, hepatitis, toxicity or overdose of warfarin. According to Karch, it is also associated with alopecia, dermatitis, as well as bone marrow depression and painful erection. There are some drug-food interaction with warfarin use. Concurrent use of heparin, aspirin, acetaminophen, glucocorticoids, sulfonamides, parental cephalosporin, for example, can increase effects of warfarin. Concurrent use of phenobarbital, carbamazepine, phenytoin, oral contraceptive, and vitamin K can decrease effects of warfarin. Excessive intake in food high in vitamin K, such as dark green leafy vegetable, broccoli, mayonnaise, and lettuce, can also decrease effects of warfarin. Pathophysiology and goal. Blood clotting or coagulation is actually a normal process that prevents us to have excessive bleeding when a blood vessel is injured. Typically, our body will naturally dissolve the blood clot after the injury has healed. However, clots can also form the inside of vessels without an obvious injury or do not dissolve naturally. In this situation, clots can be dangerous and require accurate diagnosis and appropriate treatment. Clot can occur in veins or arteries. Here I give some of the common reasons for using warfarin, including stroke. A stroke occurs when a blood clot blocks the blood flow in vessels or artery, or when a blood vessel breaks, interrupting blood flow to an area of the brain. When either of these things happen, brain cells can begin to die. Warfarin is usually given after the initial treatment for stroke to prevent stroke caused by blood clots. The second one, atrial fibrillation. It happens when the heart rapidly beats or quivering of the atria. The atrial fibrillation usually is due to malfunction in the heart electrical system. This condition can interrupt the normal flow of blood through the heart, allowing clot to form. This clot can potentially travel through arteries, lodge in brain, and cause stroke. The goal for atrial fibrillation and also stroke is to prevent the clot from happening. Aortic or mitral mechanical heart valve. Usually people have an artificial heart valve, a device implanted in their heart of a patient with heart valvular disease to help the blood flow in their heart. However, blood clot can easily to form in these mechanical valves, cause the valves to stick. And this can also cause blockage of arterial branches anywhere in the blood and lead to a stroke. Warfarin is also administered as a goal to prevent the clots from forming on the mechanical valves. Deep vein thrombosis. Deep vein thrombosis is a blood clot that forms in a vein deep in the body. Usually it happens in lower leg or thigh where blood thickens and clump together. So the goal in deep vein thrombosis is also to prevent the clot from happening. Pulmonary embolism is a blood clot in the deep vein that break off and travel through the bloodstream. The goal of pulmonary embolism is to prevent the blood clot from happening in the first place. The heart attack. A heart attack is a block in the coronary artery cause the blood supply to the myocardium to be severely reduced or stopped. It may be caused by a block in an artery. So, one of the goal in the preventing heart attack by using warfarin is also to prevent the clot from happening. Nursing management strategy and intervention. The nurse have to instruct patient to take medication as directed. Tell the patient take missed dose as soon as remembered that day. Do not double dose. And tell them to inform the doctor if there's any missed dose at any time of checkup or lab test. Tell the patient to review food high in vitamin K and give them food sources for specific nutrients. Patients should have consistent limited intake of this food. Tell them to avoid any IM injection and activities leading to injuries such as contact sport. Instruct them to use soft toothbrush, not to floss, and to shave with an electric razor during warfarin therapy. Advise patient to report any symptom of unusual bleeding or bruising or pain, color or temperature change. Instruct the patient to consult with physician if they want to take complementary alternative medicine such as herbs or over-the-counter drugs or elbow drugs, especially those containing aspirin or NSAID, or not to start or stop any new medication during warfarin therapy if they haven't consulted with their doctor. Tell them to wear medical identification bracelet. Tell them to about the importance of frequent lab tests. It is very important that the patient has a good compliance they're on warfarin, since the risk of bleeding is really high when the patient uses this drug. Advise the patient to consult if they're planning to pregnant or breastfeed. For these cultural consideration slides, I use a peer-reviewed article by Pence and Gregory. A patient takes hemp products including omega-3 fatty acid, butcherstrom, hawthorn berry, and aloe vera. The result shows that the INR is decreased, so the healthcare provider have to increase the warfarin dose. But the healthcare provider let the patient to continue the hemp product while taking warfarin and teach the patient to take the hemp product in consistent doses because any substantial changes in intake of this substance can necessitate a change in the anticoagulant therapy. I have another cultural consideration slides because I think it is interesting. In Taiwan, where people eat a lot of vitamin K rich vegetable, they have a classification used to guide patients in recording their weekly vitamin K scores to maintain their warfarin levels. Prior study examining the association of warfarin use and osteoporotic fracture has been conflicting. So in 2014, Misra et al. Examined the association between long-term warfarin use and fracture risk at the hip, spine, and wrist in elder. They include men and women equal or older 65 years of age with the incident atrial fibrillation and without prior history of fracture. As a result, you can see the statistic. No significant association were observed between long-term warfarin use and risk of spine or wrist fracture. The second peer-reviewed article shows that genetic information and plasma concentration are beneficial in dose adjustment of warfarin. A 74-year-old Japanese woman seems that she cannot achieve the therapeutic level of PT and INR despite taking a warfarin dose 3 times higher than average. The result shows that the patient's genetic influence the effectiveness of warfarin. The patient required a high warfarin dose because of the VKORC1 genotype and induction of CYP2C9 genotype by carbamazepine. I think genetics is very interesting, and in this case it influences the effectiveness of warfarin. In last couple slides, I want to show you my patient educational handout. In this slide, I explain to the patient what is warfarin, how does it work, so they can understand the use of warfarin. I also explain why do they have to take Coumadin. In this slide, it shows that my patient educational handout pointed out that the lab test used to monitor warfarin therapy is very important to monitor. And I also show some common side effect warfarin and how to control any bleeding. This is my last patient educational handout. It says that dietary concern is very important because everything that you eat, you consume can affect your warfarin therapy. And this is my references. That is the end of my presentation. Thank you for listening and have a great summer break.